We are very happy to have Dr. Juliet Skinner on the program with us this morning, who's going to help us to get an understanding of a very complex issue, and that is the question of fertility. Dr. Skinner, thank you very much for being here with us this morning.
Thank you, Paolo.
Dr. Skinner hails from Barbados, but was trained in Ireland and with a specialty in obstetrics and gynecology. And you focus on, you operate now the Barbados Fertility Center.
Correct, yes.
I thought it would be interesting to start off by tackling some of the common misconceptions about fertility in women and men, particularly in the Caribbean. What are some that would roll off the top of your head?
Well, I think that the most common thing that I hear is, first of all, people think, well, the Caribbean doesn't have a fertility problem. Well, we're no different than the rest of the world, unfortunately, and infertility affects approximately 1 in 6 couples. And any estimates on looking at thinking, well, does the first world and the third world differ in any way, suggests that in developing countries it's even more prevalent, possibly as high as 1 in 4.
Right.
There aren't any good Caribbean statistics, and I think, yes, people tend to look around and say, well, we seem to think that we're very virile and there's people are having children without any problems, but certainly I can tell you from Barbados Fertility Centre, we treat many people from the Caribbean, and infertility is no different in the Caribbean than it is in the rest of the world. I think, the common myth in the Caribbean is strongly towards, well, it must be the woman's problem, it can't possibly be the male. Yeah. And I suppose if I had to comment on one thing, in the last, 8 years of the clinic's functioning, if I was to compare practice of Caribbean medicine for fertility problems compared to, for instance, in Ireland, one of the things that we see dramatically different is, in fact, male factor. And again, that really puts to the myth of, well, it isn't the man in the Caribbean, it couldn't be the man in the Caribbean. In fact, actually, male factor in the Caribbean appears to be quite severe. Yeah. It's almost like we have 2 poles of sperm count. We either have the very, very good or we have the very, very poor. And it's an interesting thing. Certainly, our embryologists will comment on the same thing, that, as scientists, they've worked in various parts of the world and they've just never quite seen the severity of male factor that we see here. You might postulate why that is.
Is it that all of our drawers are too tight?
I don't know, but I mean, certainly that is one of the theories. But I think that certainly the most likely answer is that the Caribbean lifestyle and practices certainly have a higher prevalence of chlamydia, which is an infection that, while we worry about it most from the female's perspective with regard to if she gets the chlamydial infection, she may end up having blocked tubes. This is an infection that also doesn't help men, that basically, again, may be asymptomatic in men. They may not even know that they have chlamydia. And in fact, actually may be a cause perhaps of drop in sperm counts over time. Is it our environment? Is it the warmth of the Caribbean? Possibly. I mean, we do know that the testes were designed to be where they are, to be slightly cooler than core temperature. So again, that is one of the theories as to, is that a reason why the Caribbean male perhaps has a lower sperm count perhaps than some?